Omaha's news leader, chronicling the stories and people making a difference in our community. This is KETV Newswatch 7's Chronicle.
Good morning and welcome to Chronicle. I'm Rob McCartney. It started in the Chinese city of Wuhan, and now the impact of the coronavirus can be felt around the globe. The illness has sparked military quarantines both on land and on water. It's taken the lives of more than 1,100 people worldwide. Hundreds of U.S. citizens were evacuated from China last week, placed into mandatory quarantines. One of those 3 operations is right here in Nebraska. 57 men, women, and children are currently being housed at Camp Ashland. Well, today on Chronicle, we hear from the people in charge of the quarantine site, medical leaders working to improve hazard preparedness, and a family who's counting the days until they can go home. To start, I want to give you a few things you should know about the coronavirus. First, you may have heard the virus was recently renamed. Last week, the World Health Organization announced coronavirus is now identified as COVID-19. Coronavirus is a respiratory illness, so some of the symptoms replicate the flu, like fever, cough, shortness of breath. But the CDC says they are working hard to protect the safety and health of Americans both in and out of quarantine.
It may seem surprising to some that we are taking such aggressive legal measures. It has been over 60 years since we issued a federal quarantine like this. The last order was issued during the smallpox era.
And here to talk with us more about the coronavirus is Shelley Schwedhelm. She's the Executive Director of the Emergency Management for UNMC. You also managed local biocontainment units during the Ebola outbreak. Also here is Dr. Eric Kosowski. He's CDC Quarantine Ashland Team Leader. Joined the Centers for Disease Control 10 years ago in the influenza division, helped fight in the H1N1 pandemic. Thank you both for being here today. Appreciate it. Real quick, do we know why the WHO decided to change the name from coronavirus to COVID-19?
Had to start with a hard one, didn't you?
Yeah, right.
But just curious, I mean, so it's just kind of
No,
clarifying,
I have
making
no
it easier.
I think just to clarify it and set that as the brand moving forward.
Okay. Hey, Eric, tell me, what is the status of the virus right now?
Worldwide, the virus is really only spreading human to human in the Hubei province, the Wuhan area in China. I think at last count there were 27 other countries that had cases, but no sustained human-to-human spread, including here in the U.S.
Okay, and what about, and this is what everybody wants to know, what about a vaccine? You know, what's the status there?
I can't really speak to that. I know that they're feverishly working on vaccines, but that's really not my area of expertise.
Right. Shelley, have you heard anything about that? I mean, working on that?
I think what we know is that a vaccine will take a while. So I think that's what we're all concerned about, is that we just make sure that we are doing our best to kind of defend and contain things and make sure everybody uses good technique.
That's something I've always been interested in, especially in cases like this. Do we have an average time frame from infection to inception to distribution of a vaccine? Any idea? I mean, I know it's got to be different for every case, right?
It is for every different disease. It's hard. So it's hard to say. With this being so new, it'd be difficult to say.
Right. Manufacturers changed too. I think with H1N1 back in 2009, it was at least 6 months.
Okay.
Maybe more, if I remember right.
So you're at UNMC. What would happen if someone here was tested positive for coronavirus? What would happen there?
Yeah, so it really would depend on their symptoms. So are they mildly ill, or do they have pretty significant illness? So if they tested positive and had pretty significant symptoms, we would admit them to the biocontainment unit as initial cases.
Right, and what happens there then?
We just have a lot of engineering controls and things in place, and a team that's highly skilled in infection prevention and control, and we would just do our best to get them supportive care and treatment the best we could to get them better.
Would you handle them the way that the Ebola patients were handled?
Yeah, there's a few things that are a little different. Okay. So with a respiratory pathogen like this, we would be more worried about, airborne movement and things like that, whereas with Ebola, it was very infectious but not very contagious. So managing secretions and things like that and waste was a big deal with Ebola.
Eric, tell me, you're in charge of what's happening out at Camp Ashland. What's the situation there?
Right. So we've got 57 people there in quarantine, and they're presently healthy and doing quite well.
And what is their typical day like? I mean, what are you trying to do for them? I mean, quarantine and staying in the same area.
Right.
It's tough.
Sure. So their day starts usually with breakfast and then a health check by our quarantine officers, and then there's lunch, and we have some activities every day. We're having town hall meetings every single day to make sure that people are well informed what's going on. And we've got a resiliency officer out there who's planning activities. Yesterday we had a birthday party for a 1-year-old.
Right.
It's not every 1-year-old who gets their first birthday in quarantine.
Right.
True.
And so is it a rigid schedule that they have to stick to?
Oh,
or?
not at all, no. And they're free to mingle about both inside the building and outside. Now, they can't leave the immediate quarantine area, but there's a building with gym equipment in it, and then another more open area, sort of a playroom for kids. So when the weather cooperates, the people are outside actually playing, throwing the frisbee and blowing bubbles and
Nice.
having a good time.
That's a big win, the weather cooperates.
Right.
Hey, I was looking at your bio, Dr. Kosowski. You led CDC's efforts to build health security infrastructures abroad, infrastructure for handling things like epidemics and pandemics. What can we do here to be better?
Well, we can do more of what Nebraska has done with the biocontainment unit here at the university. To be honest with you, I think this serves as really a template for what we ought to have in many more places all around the country.
Specifically how? I mean, is Nebraska just so far ahead of everybody else?
Well, yeah, I mean, there must have been a lot of foresight that went into developing it here. But when you have a biocontainment facility like this, what it creates is a lot of downstream effect that benefits everyday Nebraskans. So it's better police and fire and ambulance services, all trained for extreme situations. So it's been really a very good partnership, and has made our CDC's life a whole lot easier here, having the biocontainment unit.
Right, and you see that too. I mean, you talked about the downstream effects and everything like that. What has been the impact of having this and Nebraska being in the forefront?
Yeah, one of the things that we do is we have a briefing every day, and all of our federal partners are in similar spaces and communicating and coordinating, and it's just been great to partner on that. And we have many other programs that we already partner with CDC and the Assistant Secretary of Preparedness and Response on. So this was just a natural good fit, and I think as he said, it's just been great to plug and play, so to speak. We've provided a lot of support services, and then having the ability to be there, if needed, if somebody got sick, we have the transition and care that might be required.
I do want to ask you, what is the difference between coronavirus and like a regular flu, if you will?
Yeah, so there's a lot we don't know about the virus yet. That's probably a better question for our physician here, but many of the things that we do for influenza should apply. So good hand washing, if you're sick, stay home. Social distancing when needed, to avoid others, if you're ill. So I think a lot of those things will apply to this virus, but we just don't know a lot about it yet.
And because we don't know a lot about it, Dr. Kosowski, I mean, there's a lot of concern, there's a lot of fear. I mean, I've gotten emails from people who say, I order things and they come from China, just, made in China, and it shows up at my door. Am I at a greater risk for getting the coronavirus? What do you tell people like that?
Right. There's no evidence that this coronavirus poses a greater risk for packages and things of that sort than really any other coronavirus or an influenza virus for that matter. So what we know about the other coronaviruses is that they don't persist very long on surfaces. And so we really don't think that poses a greater risk to anybody.
Is there anything that people should or should not be concerned about with this finally? I mean, are there any rational and irrational fears?
Well, I think certainly it's new, and so it's scary for people. That's quite understandable. But you know, like Shelley said, we already know how what to do. This is wash your hands, cover your cough, stay home when you're sick, clean the high touch surfaces in your home frequently, things like that, and those measures do work.
Shelley, any last minute advice for anybody about being calm and or their concerns? I mean, what do you tell people?
I think having a great plan is always important. So, for example, we don't know if this virus will become, more than just as it is today, and perhaps become a pandemic. So, what are the things we can do to, in advance, be ready and prepared? So, for example, we do a lot of collaboration with public health and our coalitions locally, at state level as well. And even today, we did a conversation with our Region 7 partners here in the Midwest. So just really a lot of education and training and preparedness.
All right, Shelley, Eric, thanks very much for being here today.
Thanks.
Appreciate it. Well, still ahead, a multi-billion-dollar expansion proposed for the UNMC campus, how the new plans for hazard preparedness could impact people in Nebraska and around the world. You're watching KETV News Watch 7's Chronicle.